Hello, welcome back to my YouTube channel. My name is Joanna and I am an interpreter, and today I'm continuing the series of videos called medical terminology for interpreters, so we can be the best interpreters possible. This is video number 5 from the series called Cardiovascular System and the minimum base of terminology interpreter must know in order to be ready for their medical interpreter encounter. This part of videos, I call them passive learning because this is type of the learning that we do by reading, by studying, and for me personally, this is the most difficult part of the studies, because the passive learning is the one that you try to digest something that you read and so on and so on. In the last few videos, we talk about the cardiovascular system and medical terminology that interpreters need to know related to cardiovascular systems. I am repeating, guys. First of all, thank you for the likes, subscriptions, and shares. And before I start again, I would like to repeat, I am not a doctor. I am just an interpreter. I have a master's degree in business and science. Actually, I have 3 master's degrees, but they are not in medicine. So I study medicine. I make few training classes here in America in order to prepare myself. But out of any school and out of any class that you guys can take, the most important thing is day-to-day study, and this video is just to listen. Day-to-day study, passive learning or listening or studying, reading, and so on. And this is gonna be just medical terminology for interpreters. If I made mistakes, I think I did make few mistakes in the previous videos, I'm apologizing. If you watch the entire video, it's clear, but still I want to say I'm sorry for that. But you guys smart, I believe in you. You can make it, you can do it. We're all humans, we made mistakes. Just remember, if you interpret and you do make mistake, as I did in my videos few times, remember to immediately correct it. Remember to immediately clarify that. So let's start with our video number 5. I'm gonna develop 3 videos today. One is gonna be called problems with the blood vessels and a cardiovascular system. The second video will be the most common heart problem, and the third one will be the most common tests we do. All these videos, every word that I talk or every other word is a medical terminology that you have to know in the target language. Okay, so starting with we did have a few videos talking about the blood, correct? That was the last few videos. You can click on the links over here and find those videos if you want to know more about cardiovascular system. I have a small diagram as always, and I'm just gonna repass it with you guys. So there is a small painting over here. Let me see how you're gonna see it. Okay, we see it now. This is a graphical representation of human blood. I'm so sorry, guys. Okay? Let me see the angulation. All right, wonderful. Too much light. So we have 90% of plasma, very little percentage of white blood cells, and 7-8% of red blood cells. Exactly the percentage I'm not sure, but I know the plasma, the liquid part, is 90%. I have a different graphic of the white blood cells, red blood cell, and then the plasma or the liquid parts, which I will be honest with you guys, I am not going to make a detailed test about it, because in 5 years of interpreting, The maximum terms that I had to use, it was the white blood cells, red blood cells, and platelets, um, and plasma. So when the doctors use these terms and when they explain some kind of a problem, they go in detail. And for me, the most important thing is to know what is red blood cells, white blood cells, and plasma. And eventually that's sufficient uh, to survive. Let's say if you interpret in a very particular encounter, sometimes you're going to be challenged, but I'm going to stop on the most important things. Okay, let's start with the most common problems related to blood disease, and so on. The first one is anemia. Everybody have heard about the anemia. What is anemia exactly? Lower blood cells counts. So there is a different explanation of what exactly is the reason for these lower blood cells, but mainly people that have anemia do not receive enough oxygen-rich blood, or their blood doesn't carry enough oxygen to the rest of the body. This anemia problem could be a result of a different problems: iron deficiency, a very strong blood loss, bleeding could be a reason of wounds, or so on and so on, or lack of red blood cells, not enough red blood cells production in the body. So this could be the reason behind anemia. Could be diet, hormones, disease, or pregnancy. There could be different reasons for that. Or iron deficiency. A lot of women during pregnancy have to take vitamins because the iron levels go down. There is explanation how the iron and the hemoglobin carry each other, and they're the result of the red color of the blood. But the most important things that you have to know about these blood cells, that they carry oxygen from the lungs to the body. Talking about the red blood cells and their function, you don't have to remember all that. The most important thing is that have to know what anemia is, the term. Iron deficiency, that's something you're gonna encounter often. Lack of red blood cells or not enough red blood cells productions. The symptoms of anemia are tiredness, cold, dizziness, irritation, laziness. And if it's a long-term anemia, that could damage the brain or the organs and so on. There could be also shortness of breath and headaches involved with that. But having one of these symptoms doesn't mean you have anemia. Normally, the anemia is something that the doctor can diagnose thanks to the blood test. Okay, sickle cell anemia, it's a similar thing to what anemia is, but it's a particular type of anemia. What is exactly mean? This is when the body produces irregular shaped red blood cells. These irregular blood cells, irregular shaped blood cells, first of all, have a less life than the other ones. Then they can block the blood flow and cause pain or damage of the organs. So there is a special studies again that's through the blood test. I am not sure exactly what other specific test, but I believe there is a specific blood test for that. Just like that, Rafi, you have to know what this means. What are the symptoms again? Similar to the regular anemia, we have dizziness, fatigues, low oxygen in the body. Again, if they check your oxygen, that could be a reason. blood in the urine, infections, pain, cold, flu, shortness of breath. There could be many similar symptoms to the regular anemia, guys. Just again, I repeat, very roughly, try to have a general knowledge of what that is. Again, number 3, related to the blood and the blood vessels disease or problematics, it's called varicose veins. I believe we all know what varicose veins are, but I'm gonna give a small explanation so you can imagine it. Medicine make it simple for you guys. This is a swollen, twisted veins that are under the skin and often can be seen on the legs or other parts of the body. So in each side of the veins, I don't know if you guys remember, if you can click here on our class when we talk about the blood flow and the veins, we showed that there was a small valves on each veins that keep the blood flow going to the same direction, right? So if sometimes these valves are not properly working or they're damaged, this causes the blood to go back to the vessels and pool or retain there. This can cause, first of all, the veins to swell and then to create these varicose veins, zigzag veins that we could see on our feet. Normally, this kind of problem is not a huge problem, especially if on the feet. There are different situations in which those varicose veins are treated. Some of them are aesthetical, they can be removed and so on and so on. Some of them could be for health reason if they're on the wrong place or the varicose veins are combined with some kind of a blockages that could create a problem. But this is not like a major medical problem. Okay, aneurysm is a similar condition to the varicose veins. It's like a bulge or ballowing on the wall of the arteries. Aneurysm because the arteries are bigger and this bulge that create on the bigger arteries or on the aorta, that's called aneurysm. This aneurysm, this bulge on the large veins or aortas basically, they can suddenly burst and create stroke. So having this kind of condition on the arteries is little bit more danger. So if the doctor find them, they regularly do find them through different testings that they do on the body system. They can find them in different places: arm, back, abdomen, legs, and so on and so on. They are normally cured with medicine and surgery. All right. It's similar to the varicose vein, but is little bit more specific because this kind of bulge are a little bit on a more strategic place, like the main vascular system. That's why aneurysm is a little bit more dangerous. Symptoms, I said pain on the arms, on the back, on the abdomen, legs, bleeding and headache could be eventually symptoms of aneurysm. And then we're gonna talk about cholesterol. This is something very, very common. You're gonna use it probably on daily basis. What cholesterol is, let's start with the fact that our body have 2 types of cholesterol: the good cholesterol and the bad cholesterol. So the good cholesterol is the one that remove the remainings or cholesterol from the blood vessels and carry it to the liver. It's called HDL. And then we have the bad cholesterol that is called LDP, LDP, low density whatever, I cannot pronounce this, but LDP, lipo something. Come on, lipoproteins. Okay, so let's explain what cholesterol is in a simple way so we can all understand it and easily remember it. The cholesterol is a waxy fat-like substance that is normally into the body cells. So we do have cholesterol normally, okay? But let's say this is kind of a controversial, but let's talk about the vitamins, the hormones, and so on and so on. This kind of substance is naturally in the body and help this cholesterol, the good cholesterol, together with the enzymes and so on, related to the liver function, the bile that is produced in the liver that go to the intestine, all together help for the body to break the food down and make nutrients, right? So, but if this substance cholesterol is too much, combined with all these other substances or some of those other substances, can become sticky and attached to the vessels, the walls of the arteries. This attachment to the walls of the arteries is called plaque, and they say often that we can control cholesterol with a diet. There is a people that have low cholesterol and they have to eat a certain food, and these people that have high cholesterol. And again, when we talk about cholesterol, we talk about the bad cholesterol, not the good one. When it's high, we have to keep diet. Less eggs, less yolk, less meat, less cheese, less fatty food in order to help our organism get rid of that extra enzymes or whatever you want to call this waxy fat-like substance called cholesterol. Normally, if the diet doesn't help, there is a medicines that help this kind of problems. There is a numbers here which we don't need to know as an interpreters, guys. If you just want to have a sufficient level of a medical terminology knowledge, that was it. Let's repass. We talk about anemia, sickle cell anemia, then we talk about varicose veins, aneurysm, and cholesterol. That was everything from Ioana Mirror Interpretation Todorova, guys. That was video number 5 about the most common disease related to blood and blood vessels. Thank you for being here. I hope you have a wonderful day. Bye-bye.